Hi, my name is William Carter, and I am one of Massey Cancer Center's rehab medicine physicians that works in the supportive care clinic. Today I'm going to be talking to you about the second most important strengthening exercise that can be performed to prevent deconditioning in the setting of cancer and cancer treatments, and that is the plank. And so why is the plank something that is so important and so useful to focus on in this sort of setting? Well, your core helps stabilize all sorts of other activities that your body uses. So someone who has no core, even if they have full leg strength, will have trouble walking because their core will be wobbly. If you need to reach out for an object, such as me reaching for this phone, if you don't have the core to do it, it's a much more difficult task to perform. So the core, if it's strong, makes everything else look stronger. And so why do we need to focus on this so much in this setting? Well, the core is one of the first things to go if you become deconditioned and spend more time in bed, such as when you're in the hospital. The core, if you're having surgery on it, gets terrorized. The core, with receiving steroid medications, can become very, very weak as well. And steroids are very often given during radiation therapy time, as well as part of some of chemotherapy treatments for your cancer. So many people might ask, why would you recommend doing a plank as opposed to doing sit-ups or some sort of other activity for the core musculature? The biggest reason for recommending the plank is it does a lot less. It puts you at a lot lower risk for other issues. If you have back pain or disc problems, you're not likely to herniate a disc from it or have any sort of other side effects, as opposed to crunches or sit-ups. Those can cause damage to structures. Key concepts that are worth recognizing for any sort of exercise program. Anything is better than nothing. Exercise is benefit. Key concepts for any sort of exercise program. Number one, anything is better than nothing. So the goal is to keep moving. Number two, exercise benefits are maximized when you are taking care of yourself the best that you can in other ways. So getting good sleep, getting good nutrition, allowing your body to heal appropriately. Number three, muscle soreness is okay after these exercises. If you are having joint pains, then it is probably worthwhile modifying these exercises. And if you're having trouble doing that on your own, this is the time to seek out assistance either from a personal trainer or a physical therapist. Through a few of the types of plank exercises that can be performed. And there's different gradations for what sort of conditioning that you're in. You can consider doing exercises against the wall if you are more deconditioned, and then the lower down you go, the harder it will be. So you can start at the wall, you can go lower and lower, you can transition to doing a plank on the chair, you can transition to going on the ground and going up on your arms, and then if you really want to go complex, you can lift the leg up. All of those things can further. You have your plank against the wall. Where some of the big focuses are you're going to be keeping your back very flat and straight, and you should be feeling it in your core here. And you're holding it until those core muscles are tired. That is the goal. You can go a little bit lower, but that's harder. Or you can go on a couch, or you can go on the floor, or